As hygienists, we always assume patients know how to brush their teeth. And what I've realised is that not everybody does, so I think we'll just dive straight into it, yeah? Now, I'm not talking about whether you use an electric toothbrush or a manual toothbrush or your technique of how you do that. You need to kind of speak to a dental professional for that advice. We might do another video, we'll see how things go. But basically, I'm talking about when and how you brush your teeth. So, basically, people always say, do you brush before breakfast or after breakfast? So, as dental professionals, we always say brush before breakfast because if you've removed all the biofilm, which is just a new word for plaque, then you have something to eat for your breakfast. So say you have a strong black coffee, then the bacteria in your mouth isn't going to be able to be stained by the coffee because you've removed it already. And most importantly, it's for acid erosion. So basically, if you have something acidic in your breakfast, like some cranberries or kind of some fruit juice or something of that nature, if you then brush your teeth within 2 hours, so we used to say half an hour, but we've kind of decided that 2 hours is a bit safer. If you were to brush your teeth in that time, then you're actually brushing the acidity particles into your tooth structure, so you can cause acid erosion. So that's the reason why we say brush before breakfast. Now is also the time to use a water flosser. So if you're using a water pick, for example, you need to make sure that you do that before you brush your teeth. Another little side thing about water flossers is the best thing to do is use them with warm water if you have a little bit of sensitivity. Make sure that your head is right over the sink. You're not going to kind of do your water flosser standing upright, otherwise you're going to end up kind of with a shower all over the bathroom. And also you need to make sure that you follow the contour of your gum all the way around and then back on the inside as well. Don't just kind of pop it in between your teeth. So if you haven't used a water flosser and you're just going to use your TPs or string floss or easy picks or something of that thing, then the best thing to do is brush your teeth first and then use the little brushes. It's not a clinical thing, but for me, I know myself, if I brush my teeth and and then I use the little brushes and I can see the extra little bits of the bacteria that I've removed, then that motivates me to make sure that I always do it because it shows me how much I've missed with my toothbrushing technique. Then the next thing to do is just spit, don't rinse. Mouthwashes aren't magic, okay? So don't rinse with water, don't rinse with mouthwashes. Literally just let your fluoride toothpaste sit on your teeth for a little bit longer to protect them longer. Don't rinse, and as I say, kind of you need to make sure that you're brushing your teeth twice a day. Once in the morning, first thing, as soon as you get out of bed, and the second is last thing at night before you go to bed, because your saliva flow stops overnight when you're asleep. So if you eat anything after you've had that beautiful fluoride application, then you're leaving those sugar particles on your teeth overnight, and nobody wants to do that because that's just nasty. But yeah, so brush twice a day and always make sure that you clean interdentally at least once a day, because if you just do it a couple of times a week, that's just nasty.